Allora bene, ora introduciamo la lezione magistrale del professor Nardone, Giorgio. Io in realtà dovevo fare un'introduzione.
We now introduce, can you hear me? Yeah. We now introduce the keynote lecture delivered by Giorgio, Professor Nardone. I was supposed to give an introduction myself.
Ma siccome c'è poco tempo, mi concedo solamente una piccola cosa, se vi va.
But time flies, so I'll just add one more thing.
È un aneddoto, è una mia esperienza personale, essendo riformato da Giorgio molti anni fa.
A personal anecdote, I was trained by Giorgio some years ago.
In questo caso fu quell'elemento che mi convinse una volta per tutte di fare la sua scuola.
And that gave me the idea of following his school.
Mi trovavo dietro lo specchio, diciamo così, dietro la telecamera, a guardare una psicoterapia abbastanza complessa.
I was behind the mirror and I was observing a rather complex psychotherapy.
Quindi era una famiglia con una madre e una figlia, francamente psichiatrica.
It was a family with a mother and daughter who were frankly psychiatric.
E Giorgio era con una coterapeuta.
Giorgio was working with a co-therapist.
E questa ragazza non c'era possibilità di interagirci.
And it was impossible to interact with the daughter, with the girl.
Perché ogni volta che Giorgio provava, o la coterapeuta specialmente provava a interromperla, questa qui urlava come un'ossessa.
Because every time Giorgio and his co-therapist tried to intervene, the girl started screaming.
Che era proprio il classico impasse, il blocco che non si può risolvere.
So they were stuck.
Qualunque persona a un certo punto avrebbe chiuso la terapia, preso dal panico.
And anybody would have panicked and given up.
Poi mi accorsi che a un certo punto Giorgio prese un foglio sotto il tavolo.
Then I realized that Giorgio was taking a piece of paper, a sheet of paper,
e scrisse qualcosa.
and he started writing something on it.
Prese questo foglio e glielo fece vedere a questa ragazza che stava urlando.
And then I took the paper and showed it to the girl who was still screaming.
In questo foglio c'era scritto: posso interromperti?
And on the paper he had written, "May I interrupt you?"
Questa ragazza immediatamente si interruppe.
And the girl stopped screaming, actually,
Perché aveva usato un altro canale.
because he had resorted to a very different channel to communicate.
E allora lì capì che la strada giusta per me era quella.
And I understood that I really wanted to follow that way.
Grazie, Pastore.
Thank you.
Please allow me to start introducing the first person that utilized for the first time as if therapy technique. Is not a therapist, but a really great philosopher, Blaise Pascal. Blaise Pascal wrote a letter to really close friends, writing, "I apologize, dear friend, because my so long letter, but I have not the time to write a briefer one." That introduced perfectly my topic, the idea that psychotherapy is a performance. A psychotherapist is a performer. So I take distance from everybody in our field that suppose that the psychotherapy is just a loving encounter. just an empathy meeting. Because I suppose that this is a really important factor to create good empathy, good rapport, respectful relation. But to build up that, you need to be able to do it. And if you will be able to do it, you have to learn some strategies, some abilities. So, from my point of view, and Steve DeSheza was really in a complete accord with that therapists must be able to perform during the therapeutic dialogue, introducing new things, new perspectives using techniques, and elaborating, readapting continuously technique to the person in front of him or her. So, what means for me performance? Performance is not this simple application of technique. Performance is more than technique. Is when someone offers beyond technique his or her personality, capacities, in the sense of how to act and how to speak. If you would like to observe in a really simple way what happened during a therapeutic dialogue, you can observe that the therapist act, do some things through non-verbal behavior and inducing through techniques the patients to look his reality from new perspectives and driving here to discover new way to treat what in the past appeared impossible to treat, to manage. In doing that, he or she are using language. And language is, for psychotherapists, the fundamental instrument. But language is not simple speaking, is acting. Wittgenstein say, words are like stone that you launch to the people, or like the bullet of a gun. So, if you like to create a good relationship with the patients, you need to be able to create the right atmosphere. And the right atmosphere depends by your ability to construct it, not to the ability of patients. The so-called respectful dialogue seems to me a paradox for psychotherapy. Let's imagine that I respect a person with a strong depressive disorders, and so I join him to complain, to play the role of victim. It's not therapy. It is to help the patients to continue in the stream of his pathology. So, therapists as performers must be able to find and to present and to play the role of who is capable to introduce new realities inside the dialogue. not simple respect the patient's attitude and belief. To be so respectful is to be not therapist. I know that my statement is really strong, okay? But I am used to do it during many years ago, okay? So, what I like to introduce to you is the idea that a good brief therapist, and not only, even a long-term therapist, to be effective in her treatment and to be really honest and to be really correct with the patients, must to do the best to create the possibility to escape from the sufferance, from the disorder of the person. So, every way you use to do that is really correct and ethical. Is unethical to be friendly, empathic, do nothing that you can do to drive the person to get off from the problem. When Steve de Cesar was proposing Marco question, the looking for exceptions, do some things actively. And if you look, as I have done many times, some of his therapy, you could observe how much of intensity Steve always put in looking the person, using the voice, using the poise, so non-verbal, paraverbal language. In addition to the verbalization of the technique, the miracle question, and the attention that he always put on, make the person looking from different ways of miracle happened. What we'll do differently, what we feel differently, as if the miracle was happened. So, rethinking psychotherapy as a real performance transform the role of therapist in a role of really active actor of the session, the real actor of the process. The idea that patients and therapists are in the same level, let me say, is idealistic. It's an hypocrisy from my point of view. Because patients came to be helped and give on your hands her situation or his situation and ask you, please help me to change. So the responsibility is on the hand of therapists, not on the hand of patients. Mainly at the first of the therapy. Of course, then the responsibility will be split. But during the process of change that occurs, let me observe, for example, common factors of change in psychotherapy. I suppose that the most part of you know this research perspective. These authors demonstrate that the four fundamentals factors for therapeutic change is the expectation of the clients, the relation during the therapy, the placebo effect, and the technique. From my point of view, appear ridiculous that they say that the technique is just 15%. Really nice point of view. But during a starting time of therapeutic dialogue, if I play the role of brief therapist as Steve DeSheza indicated, so looking the person, slowing my language, using words as music, propose miracle, propose exception. All these techniques and all this way of communicate is a real performance in create more expectations, in create a therapeutic relation, but this is technique. Of course, the more the personality of the therapist is with strong ability for that, and the more the technique will be efficacious and effective. So, as I said before, there are always the double role of techniques, personalities, context. But if I give the real necessary attention to the techniques in terms of what I have to do, in which way I have to present that by language, non-verbal, paraverbal, and verbal, the way of through I argument some contents, the different way to present a topic, putting the right attention and the really painful, a prolonged time of training to be able to do that. Okay, everything appears natural, spontaneous. In not expert of psychotherapy, not only brief therapy, all kinds of psychotherapy, looking at a session of Steve DeSheza, Claude Madanes, John Wickland, Paul Watzlawick, work on mine, usually say, everything appears so simple, so natural, so spontaneous. Don't forget, spontaneity is the last learned things that became an acquisition. So what seems to be not techniques is the most sophisticated techniques applied in the right way. So to be a good brief therapist, even a good psychoanalyst, okay, must be trained for a long time with a good master, supervise the future therapy, to learn, to be able not only to use technique, but to adapt the technique to the patients through the specific kind of language that fit to him or her, that match with the context of the patients, and that fit and match to the personality of the therapist. So, when I say therapy as a performance. There are no same therapy, even in the same cases, because the same technique is always the same, but always different, because the use of language or relation that must be adapted to the specific kind of patients, of context, of family, of experiences. Both of the clients, patients, and of the therapist. So, as before Professor Pericogna said, it's real to be a brief therapist. You need more prolonged time than to be long-term therapist. I remember one of my professors at the university time that you met, Professor Lazzaroni, said to us, young researcher and therapist at the first experiences, please start to work with child. Big pause and said, because nature help a child to develop. So you have in nature a big alliance. So long-term therapy have on the part of time that evolve a good alliance. Not always, because sometimes the time make worse the situation. Above all, in the psychopathology that I treat ordinarily, so obsessive compulsive disorder, panic disorder, eating disorder, really severe anorexia and vomiting, in this case the time is not a friend, is the worst enemy, because the situation became worse and worse and worse. Coming back to Esif, I referred before Pascal as the first person to use Esif technique. If you read his really fabulous book, Thinkings, okay, you will find the really famous Pascal Weger. When Pascal operated a large society therapy or large society process of persuasion, because the problem of Pascal was how can I carry back people that are escaping from the church, from the believing in God, because you know the period of the Christian church with Inquisition and indulgence selling and so and so. And he proposed the really illusion of alternative question: what is more convenient, to believe or not believe in eternal life after the death? Of course, if you choose not believe, when you will die, if in the other life there are nothing, you will lose nothing. But let's suppose that there will be eternal life. You will get lost eternal life. What is more convenient? And this is a really persuasive illusion of alternatives question. But if Blaise Pascal stopped his work here, he had done half of the work to persuade and to create a change in people. As a therapist, if speak during the session, propose something really interesting during the session, and forget to give indication to be applied during the life outside the office. Transforming a dialogue in action is an important, fundamental part of therapeutic change. Pascal, already aware of that, proposed, dear people, don't worry if you will continue to have doubts, not believing, not trust on church, on Christians. Behave as if you already believe in it. The faith will arrive soon. This is the first formulation of as if technique, and was so successful that the most part of people escaped from Christian faith, come back to church. Marvelous social therapy. If you came closer to our time, we had many thinkers speaking about as if technique in the sense of how to use this fiction to create a reality. The list is too long to be explained here in this brief presentation. The person that for the first time create as if therapy technique has been Paul Watzlawick, my master. He, in the last years of 17 of the past century, start to create this technique, asking during the session to the patients what you will do differently during your day as if your problem were overcame, and exploring all the things that the person will do differently, and choosing together the littlest change to introduce in real life. So, as if as an invented reality, to create later a real action into the life of the patients. During our collaboration for more than 20 years, we have together elaborated many versions of this technique, many different applications. As you can have many applications on miracle questions. And the real marvelous effect of this technique that you can use it not only in therapy, you can use it effectively with manager, with sportsman, with artist, because it's a real ancient way to create something invented that produce real change into the life. And if you analyze this process, this technique in a really detailed way, again, you come back to the idea that therapy is a performance. A therapist must be a performer. Thank you very much.